This session for the DIP and steering committees is looking about what are steering committees and how do they work. So again, the project has 4 different aims. And one of the main aims that the steering committees work with is aim 3, which is to look at ways to foster an environment, both the physical and the social environment, that support greater health and well-being for all of the community residents. DIPN, it has the 3 steering committees as illustrated on this slide. And we also have a DIPN Savvy website that's available for you if you need additional data about your community that might be used for grants or other types of project development. So what is the mission of the DIPN Steering Committee? It's to include resident voices to help make decisions on behalf of the community, to ensure that the aims of the DIPN project are met in ways that are acceptable to the community residents. It's to assist with long-term sustainability of the project aims. We want to make sure that the things that are started as part of the project continue after the project ends. And we want to have the steering committees assist with overall quality of life in each of the communities. So what are steering committees? They're really advisory groups. Members are selected based on their expertise or position, or because they're a stakeholder, or in our case, a resident of these different neighborhoods that we're working in. Steering committees meet periodically to help discuss progress and help to set goals or reset goals and the direction of projects. The key concerns of steering committees usually include the direction of the project, budget, timeliness of activities, and methods that are used to conduct and evaluate the project. Some specific roles and functions of our DIPN steering committees. Each neighborhood resident steering committee set their own operating guidelines, and these are reviewed and updated on a regular basis. The goal was to have the majority of the community committee be residents of the neighborhoods, and there are similar demographics of residents in each of the neighborhoods that we selected. We also want them to, they have assisted us in priority setting those focus of our primary prevention actions that we've been operating to try and address in the last 2 years. They've also assisted with recruiting new residents to be on the steering committee. They review proposals and approve them. They assist with monitoring and evaluating the DIPN project, both helping us to distribute surveys and helping to identify people that we use for some of our key informant interviews. They've helped establish budget priorities. They monitor expenditures and outcomes of the projects that have been accepted. And they share information about risk factors of diabetes and encourage screening if indicated. They also can be asked to advocate for policy changes as indicated to meet our project aims. So what are individual roles or functions then if you're on the DIPN steering committee? We want you to attend meetings on a regular basis. We want to help you understand the outcomes of DIPN. We want you to work as an advocate for the project, talking about it with people in the community. We ask you to review minutes and proposals and vote as needed when asked to. We ask you to contribute to the agenda before the meetings and help to collaborate with our community health workers, both in sharing information about programs or events that they're hosting, and helping to make sure activities are coordinated within each of the neighborhoods. So actions on behalf of the steering committee. Steering committees usually don't perform the work. They're there to help identify and work with project managers, or in our case, those that have proposed the different projects that are occurring, helping to involve other organizations within the neighborhood to help promote those proposals. It is often helpful to have a resident chair of the committee, and some of the steering committees are moving in that direction. Having active resident participation is really critical to being able to meet the aims of the project, and being carefully in your review of materials that are sent to you before the meetings. Being prepared to vote is really critical in helping us to move those proposed projects forward. And then being open to discuss is really key to getting the work of the steering committees done. Here's some additional references. And if you have additional questions, please contact myself or others on the project team. Thank you very much.